Hello, Dr. Miaken here with Zeigler Chiropractic, and I want to thank you for being here with me today. Time is an investment, and certainly understanding you being here today, plugging into this recording for the next 25-30 minutes to really dive into a core chiropractic concept where we talk about subluxation and the subluxation complex. I understand there were probably things that you needed to rearrange in your schedule to show up here. So I first want to thank you for investing the time. I secondly want you to know that I promise to be my best as both a chiropractor and person to give you information that will, I believe, uplift your knowledge and understanding of your body and help you make better, more informed choices in terms of your health today and moving forward. I ask that you be open to receiving this information. We only have this short period of time. And so I hope that you will come today with an open mind, an open heart, and be willing to grow with me so you can be a better you down the road. And let's begin with discussing the subluxation complex, which is a core chiropractic concept. It is, I think, vital to understand why you are getting adjusted, what we're looking for, and it'll help you better understand the choices that you continue to make in terms of your health and well-being. So let's just first talk about not the subluxation complex, but health. And a great definition of health. I mean, I know you've heard me talk about health being not just how you move, but not just how you feel, but how you move, okay? How you eat, how you think, how you hydrate, how you sleep, what you do to continually build resilience within the body. But if we break that down, we have these components out here. What do those components allow for the body? And simply put, it allows for a body that is more highly adaptable. When we talk about health, understanding that adaptability is a measurement in function and a measurement in resiliency of a body to respond to its environment. And so human health and the existence requires this dynamic capacity of adaptability to allow for multiple evolutionary trajectories to take place. So what does that mean? Let's use the example of a missile launch, right? If we are launching a missile from the ground, and we have this goal for it to land in a very specific location, right? What do we need to know? What's the wind speed, right? What's the humidity in the air? What's the launch in terms of force and momentum behind that missile? And what's the angle in which we're going to launch it, right? All of these factors will contribute to its end trajectory, right? And I think it's worth considering human existence and what our trajectory can be at the start of life for you to end trajectory be experiencing a level of health and expression of vitality. And our adaptability is dependent on our experience of stress and our physiology, and how we adapt to that distress determines how the stress may or may not affect our end trajectory in life. So I want to just share with you a picture. Okay. Let's say we have a child whose entrance into this world was challenging. Okay, there were complications during the birth process that required mom to have an emergency C-section. So baby boy was born from the start with a difficult, life, difficult starting point. And anyone who knows, if you traveling through the vaginal canal is really important because it helps gulping happen. So it helps seed our gut and our microbiome, which is directly proportional, connected to the health of our immune system. So he constantly cried, rarely slept, had trouble with digestion, was always uncomfortable. And mom could barely console him. Oftentimes, to relieve his discomfort and symptoms, she would give him medicine prescribed by the doctor because he didn't sleep. He was crying. He didn't have normal, healthy digestion. And so medicine was what she knew to give with the doctor she went to. And as he got older, he had multiple ear infections. They had to put multiple tubes in his ears. His body would not accept those tubes, kept pushing them out. So they kept putting multiple tubes in the ears, had asthma, food, seasonal allergies. By the time baby boy is 5, he's taking a daily inhaler, has an antihistamine for his allergies, a laxative to allow him to go to the bathroom, and he's on intermittent rounds of antibiotics due to his ear infection. And as he gets older, he starts gaining weight, becomes self-conscious about his body, doesn't like to play with other children. Because his allergies tend to flare up frequently, he spends, little time outdoors. So he spends most of the time inside playing video games by himself. And that's really the majority of his extracurricular activities. He finds comfort in foods, loves candy bars, chips, gummy bears, McDonald's. In the classroom, his teachers start to notice his inability to pay attention during class, and he finds himself with the label ADHD. His health problems continue to nag him throughout life, both physical and mental. He often experiences bouts of depression, anxiety, movement and physical activity hurt his joints due to arthritis. He has trouble balancing. Sometimes he's wheezing and out of breath, and his annual physicals present no good news. High blood pressure, cholesterol, irritable bowel, and the list goes on. I share this with you because, unfortunately, I believe that this is an average kid. And when we're talking about adaptability and the trajectory in which we start our life, how we start our life, I think, is so important. And what we do to continually support and tweak those variables to support a healthy trajectory in life is so vital for 10, 20, 30 years down the road. And that's what I want you to think about in terms of health, is how adaptable and how resilient is your system, and what are the variables you're using that can literally change your trajectory for a better expression of life. Our founder, Dee Palmer, was asked, what is the why of health? And in terms of chiropractic. And this was his response: the science of chiropractic has modified our views concerning life, death, health, and disease. We no longer believe that disease is an entity, something foreign to the body, which may enter from without, and in which we have to grasp, struggle, fight, and conquer, or submit and succumb to its ravages. Disease is a disturbed condition, not a thing. So what he means is, when you look at traditional healthcare, we're looking at an outside-in approach, and disease is a problem that we contracted. But what Dee Palmer, and what I would argue, is that what is the adaptability and resiliency of the host? And if you have an unhealthy ecosystem and internal environment, how adaptable are you going to be responding to these stresses outside? So that's where chiropractic looks at the inside out approach. And that's where we're going to dive into the subluxation complex. So before we get there, the first question we have to ask ourselves is, are we susceptible or resilient? How an individual adapts to stressors in their internal and external environment determines our trajectory of life. And our founder, D.D. Palmer, said that there are 3 causes of disease, 3 stresses. He called them the 3 T's: toxins, traumas, and thoughts. Toxins being chemical stressors. Right? What are we exposed to? What do we ingest? Right? What are our habits? We've got, allergens, we've got food additives, we've got smoke, we've got, pollutants in our air. Those are chemical stressors that can change our trajectory, but also stress our body. Okay, we've also got the traumas. Those are the physical stressors, typically the ones that people think about, right? The accidents, the falls, concussions, postures that we take on over and over and over. Think about, say, a golf swing, right? That unilateral swing, that's a repetitive motion, sitting for 8, 10, 12 hours a day. Those are physical stressors to our body that can, again, determine our trajectory in life. And the last one is thoughts, okay? Our psychological stressors, our emotional stressors in terms of how we perceive our world and respond to our relationships, our finances, our work environment, all of those pieces. And so when we look at what causes impact to our body and changes our level of resiliency or susceptibility, we're looking at these 3 T's: traumas, toxins, and thoughts. So keep that in mind as we start talking about adaptability and resiliency. Is, what do you think are the stressors that are contributing to your supportive trajectory in terms of moving you towards health, or trajectory that may move you towards disease? So let's talk about subluxation, because in chiropractic, we believe that the body and the brain's inability to adapt to the stresses, so the 3 T's, create subluxation within the body. We oftentimes talk about subluxation being very similar to cancer, because subluxation can be around for years, maybe even decades, where we don't even know it, but the detrimental effects and the stress to our body over time acts much like cancer. Because cancer is, sometimes it's around 6 years, 8 years, 10 to 12 years if it's breast cancer, and that's only when it's large enough for us to identify under a microscope. And cancer is abnormal growth of cells, chaos within the system. So a subluxation is a dysfunctional area in the spine, okay, that negatively affects health and well-being due to its influence on the nervous system. So the old-fashioned concept is a bone that malaligns, puts pressure on a nerve, and puts stress on a nervous system. What modern science is actually finding is that when the brain is not moving things properly in a portion of the spine, given the task at hand. So what that means is that if there's altered input going in, because the way the brain gets its information to respond to its environment is sensory input. So how the information is getting in. So if we have altered input into the brain's not able to process appropriately, we have altered output going out into the environment. So information going in bad, information going out bad, okay? We talk about that happening in the spine, but what we're actually seeing with modern science is it all begins with the brain. The brain is the hierarchy, and how the brain perceives its environment creates this response within the system. So a bone is functioning or moving in a less ideal way, in a manner that is not normal to the body. That is the subluxation. And the goal of chiropractic is to detect and correct the subluxation to restore healthy function to the spine and the nervous system. And when that happens, your brain is better able to process input and output. And that moves you towards health. That changes your trajectory, which is really amazing because this is an inside out approach, right? We want the body to be more resilient, more adaptable. So if we can improve the brain's ability to respond to stresses in your environment, those 3 T's, traumas, toxins, and thoughts, then guess what? Your experience in the world is going to be very different. So let's dive into this. And I'm going to show you a video here, but I want you to understand that your brain retains this ability to constantly adapt to the ever-changing environment. It's called neuroplasticity. It's like a riverbed in a flowing river, right? You've got this, river and this water that the contents may be changing depending on what's going on in the environment. And so you see a riverbed that's constantly changing and flowing. That's like neuroplasticity. But here's what's important. It's important that the brain is able to maintain an accurate and up-to-date inner map of what the body is doing in order to relate to each other and respond. So let's go to a video I want to share with you. This is a short 3-minute video. That we are going to be listening to.
Did you know that your brain and central nervous system are constantly changing? It's quite amazing. From one day to the next, your brain is not the same. This is what scientists call neural plasticity. So what's the cause of this change? Well, to start with, your brain receives a constant supply of messages about your body and the external environment from the sensory organs. That's your eyes, your ears, your nose, tongue, skin, and so on. With this information, your brain maintains a 3D map of your body and keeps tabs of what's going on outside of your body. Your brain needs to interpret all of this data from your senses. It translates the information it receives based on what it's learnt from your past experiences, as well as its expectations for the future, its preferences, and more. You could call this the brain's bias. There is basically a lot of background processing that happens under the radar. So how you or your brain sees a situation may not be entirely accurate. That means your experience isn't 100% based on reality, but is instead a perception of reality. Let's look at an example of how the brain fills in the blanks. Look at this picture and consider which square is darker, square A or square B? Which is darker now? It's incredible, isn't it? Your brain doesn't just see what the eyes tell it. It interprets what the eyes tells it, based on other information it has already stored up. In this case, you see square A as darker than square B because square B is in the shadow of the green cylinder, while square A is outside the shadow. Based on your brain's past experience, it will decide for you that if a square in a shadow reflects the same amount of light as a square outside the shadow, then it must be a lighter shade of grey. So what happens if your brain's map of the body is inaccurate, or if it's interpreting information based on faulty perceptions? It may mean that your brain responds to environmental cues ineffectively. But how would you know if your brain's map of the body, or its knowledge of the environment, was inaccurate? You may find that you become a bit clumsy, that you stub your toe often, or catch your elbow on door frames. You may find that your golf swing is out, or that your concentration is just not what it used to be. Or you may be overreacting emotionally to a situation. In the next video, you will find out how chiropractic care can help reset the function of the brain and the central nervous system, improving the accuracy of your brain's map of the body and the environment so that you can operate at your best.
Okay. I love that video because that is Heidi Havoc. She is a researcher in New Zealand, and they are doing a lot of work to see how subluxation impacts the brain, and actually through their work finding that the brain is the hierarchy and it's creating these changes within our structure as a result of how it's processing our environment. And so hopefully, let me share my screen again with you. Hopefully that gave you a better understanding as to how important it is for your brain to maintain an accurate and up-to-date inner map. And I know that Heidi, and in that video, talked a lot about, you know, if you have a faulty inner map, you might notice you're tripping or you're clumsy or your balance has shifted and changed. Understand that that is, yes, that is a piece of it, but also understand that it changes your body's ability to adapt and respond to your environment, right? So I loved that checkerboard that she used to see the shading and how our brain automatically filled in the gaps based on past experiences and what our expectations were, you know, to see what we believe we should have been seeing. So know that based on how your body and how your brain has adapted to life stresses over your years and decades of life is also impacting continued response and adaptability to further stresses. And if you have, you know, if you have cumulative stress where your body is unable to respond to those stresses, we see breakdown. And that's where, with the chiropractic piece, we want to improve your adaptability and improve your ability to respond to your environment. So let's go back to this here with subluxation. So vertebral subluxation, it leads to changes in the information that the spine sends to the brain. Okay, so the altered input in. The segment is moving way more than normal, so too much movement, or it's not moving at all, or it's moving differently than normal. That is altered input into the brain. And when you change this information, you can lead to changes within the brain itself. And that, again, influences how the brain perceives and experiences things, which is the lens in which we view the world and how we respond to all sensory information. So you can see how subluxation can be really impactful in terms of day-to-day life and your response to day-to-day life. And it happens so much so over time where we don't necessarily notice those little challenges and stressors we experience until, you know, boom, we're tripping on our feet all the time, or pain is just blaring and obvious that it is there constantly, right? Some people, I find that when you start getting adjusted, you notice, I didn't realize that I was experiencing, you know, pain and challenge, you know, in the low back, because this neck pain and these headaches have been so significant. So our brain is constantly adapting to what's going on in our environment so we can survive. And so when we correct the subluxation, we're improving your brain's experience, your brain's perception of reality, and how you respond. And guess what? A side effect is you feel better, which is pretty amazing. So let's just talk about how we correct the subluxation. And we do that with the adjustment. And this came from a chiropractor who studied thermodynamics, biomechanics, and chiropractic philosophy. And I love this equation. So the adjustment is made up of multiple variables with the intent to correct the subluxation, which we know when we correct the subluxation, we enhance the brain, we enhance adaptability and resiliency within the body. Super cool. So the adjustment is the consciousness of the patient, right? So what is the intention, or what is the hope of the person who is laying on the table receiving the adjustment? Do they just want to get out of pain? Do they want better movement and range of motion? Do they want to have better clarity of mind? Do they want to improve productivity and performance? Do they want to be healthier overall and experience a level of vitality, be sick less often? Do they want to increase their adaptability, move towards greater levels of expression of health? Do they want to increase their potential? I believe that you can never put a cap on somebody's potential and what they can experience or do. We are amazing. We are intelligent. We just need to be given the right tools. So certainly the consciousness of what your expectation is around the adjustment plays a role, plus the consciousness of the doctor. So that all those same things, as I'm laying my hands on your spine, what is my desire for you to experience, right? Do I just want you out of pain? Do I want to put movement into a joint that's restricted? Or we go into that other spectrum of, do I want you to experience a potential that you have yet to experience? Do I want you to move to a level of vitality and adaptability, resiliency, so you can express health, life? What is my consciousness? Times the force of the adjustment, whether it's my hands using tools, it is the adjustment applied to the body, to the spine, plus the level of coherence. So coherence is, think about a flock of geese or a school of fish, or think about seeing an orchestra playing, 100-piece orchestra playing this complex piece, but they're all playing as one. And that coherence, right? Moving as one, working as one. We have trillions of cells within our body. And when those trillions of cells are working in a level of coherence, that is organization, that is intelligence. We want to increase that coherence and decrease that entropy, which is chaos or disorganization in the system. So when you have subluxation that causes altered input, that is chaos or disorganization input into the brain. If you have cancer are cells that are doing their own things. That is chaos within the system. So we want to reduce the entropy within the system and increase coherence. And that is what happens with the adjustment, is correcting the subluxation for you to experience a higher level of vitality and health. And if we just look at, some of the improvements that we see in brain function that are coming out of Heidi Havoc's research, it's super cool. So we see with one adjustment, we see improved brain function in improved or altered visual acuity or visual field size, so our ability to track, our ability to see our visual field size. So we're seeing changes with the eyes. We see reduced joint position sense error. So your brain's ability to know where your arm and leg are in space, even with your eyes closed. Big movements important, but also those small movements that happen within the spine, very important. We see decreased reaction time. So this is why I think professional athletes, performers, love chiropractic, because it reduces your reaction time. So think you've got something coming at you, or you need to make a quick, an immediate response, we see reduced reaction time. altered brain processing, so your brain's ability to process what's going on in your world, changes in the way the brain integrates information coming in and information going out. We see altered spinal cord excitability, whether we see a spinal cord in a system that's compressed and not having enough tone or too much tone, we see change and ease within that system. You see specific messages that change, that get sent to muscles from the nervous system, improved muscle strength in the legs, and we see reduced or prevented muscle fatigue developing. Again, why performers, entertainers, athletes love chiropractic, because we see these functional changes happen immediately. One thing I didn't include in this is one of my favorite pieces of research that Heidi has done is they did a scan of the brain before and after an adjustment, and they found that following the adjustment, your prefrontal cortex, which is your executive function, they saw 20% increase of brain activity in that area of executive function. That is goal-oriented tasks, that is decision-making, that is your ability to focus and concentrate, how you perceive pain, how you respond to emotional situations, your stress response and autonomic response. All of those pieces improved with one adjustment, up to 20% increase in that prefrontal cortex, which is so amazing. So that is just with one adjustment, and you guys are getting cumulative adjustments, right? You're getting consistent chiropractic care because we want to change what your body has and brain has thought to be normal for so long, right? We're changing neural patterning. We're changing how the brain has integrated and processed information based on past experiences and past results. So consistently, when you get adjusted, each adjustment builds on top of the next, and you are working to change your neurology, your brain, and your subluxation patterns, right? Which creates a level of coherence within the body, which changes how you perceive your world and how you experience your world, which the end result, the side effect is you feel better, you move better, you sleep well, you have better clarity and focus. So I love that you are here today to understand the subluxation complex, to understand more about your chiropractic care and how it's supporting and changing your trajectory in life, right? You are changing that trajectory for you to experience more health and vitality and express life in a different way. And everything you do that is investing in your health will do that, right? I just find that when you get the brain on board, all the other pieces are just like, the sprinkles of the cherry on top. So I appreciate you. Thank you for being here. Great job with being consistent with your chiropractic care, showing up every day. And the more you do, the longer you do that builds health, builds vitality. So you are amazing, and I look forward to hearing your takeaways in the office. But have a wonderful and blessed evening. Thanks for being here.